What's up, guys, and welcome to another episode on the channel. If you're interested in alternative careers in medicine and healthcare generally, you're in the right place. So you just start by subscribing to the channel below. So on today's episode, I'm going to be talking about 10 or 15 apps that I feel every health content writer should have or should know. Now, health content writing is a thing and it's a career for a lot of persons. That's what I also do. So, and there are tools we use to, make our life easy. So, if you're considering getting into health content creation as a career, either part time or full time, or it's something you're already doing, I think you might find this video useful, to get you updated as to what you need to do, or even tell you some of the new tools you might not have known, right? So you might just want to stick around to the end of the video to hear about all the softwares I'm going to be talking about shortly. So let's dive in. So, there are a lot of tools, a lot of softwares out there, and most times it's a bit confusing as in which one do I use? Why should I use this one? How effective it is it rather? And again, pricing is usually an issue because some of the softwares they give you the free version, but it's not so robust. It gets to a point where you're being forced to, subscribe to the software. Then it becomes a headache. You're paying to like study this app. So sometimes, you don't have an option because I think I've gone through that journey because I keep subscribing to apps, I use it, it doesn't work, and all of that. I have to switch, keep on switching until I find what works for me. Right. So the first one I'll talk about is Microsoft Word. Yeah, sounds basic, sounds very, pretty simple. But I think that's like the bedrock of every writing would do. So you've got a laptop, you've got MS Word as your operating system, unless you use a Mac, right? So MS Word is very widely used to write, to format, to edit, to include tables, include lists, put pictures, and it does a lot really for basic writing. So if you're a health content creator, I should assume, or if you're preparing to get into health content, right, I should assume you know how to use Microsoft Word at least at the basic level. So that's app number one. Number two is Google Docs. So Google Docs is a real-time writing processor, just like the MS Word too. And the good thing I like about Google Docs is, you can collaborate in real time. So sometimes I have papers I'm writing with one or two persons. It's not a single paper. And I just create the document, I share the link with them, or I add them on the document, and everybody has his or her own part of the paper to work on. So everybody just keeps on adding their part of the paper in real time. So if Olawale in quotes is typing from Aja, me in Surulere, I'm seeing what he's doing in real time and we can collaborate. So it's a very good tool for collaboration. So if you haven't tested Google Docs, then you might want to check it out, right? The next one is Scrivener. Is a writing and project management tool for long form writing. So people who do majorly research writing, or you're writing novels or short stories. So this is a good tool to use. Then the next one is Hemingway app. I haven't really used this one that much, but the idea is basically helps writers improve their writing. You have passive, active voices in writing, or you're writing in first person, second person, third person, and all of that. So it helps you highlight all of these issues so that you don't misuse them and all of that. So it comes in handy. Then next one is Evernote. Evernote is good for notes taking. Sometimes you're on the bus or you're taking a walk and you have an idea or something. So I use it to quickly scribble down a couple of notes and just save them real time, because as a creator or a content creator, in the healthcare space, you're constantly thinking of things to do. Ideas are constantly popping up every second. So you need to have a mechanism of how do you put these things down or save them so that you can come back to them later, because if you don't, chances are you won't remember. So for me, I even go a step further because apart from the software thing, I like hard things or hard copies as well. So I have a content diary. This is my content diary. So yeah, this is my YouTube content diary. So apart from writing in the software, I also come to scribble on my content diary. So most times I think I'm more comfortable when I see it written down than when it's only in the app and all of that. So Evernote is very good. Then in terms of design, Adobe, it's good. Though I really don't use Adobe that much. In fact, I don't use it anymore, but it's cool. But I think I found Canva more useful, more user friendly than Adobe. So I've switched to Canva, and these are really good. So for Canva, I use it to do my thumbnails, uh, graphics, and text editing, pictures, short videos. Canva does quite a lot, and you can achieve a lot on Canva on the free version. So you might also want to check it out. So I think it's every tool a, a creator should have or should use. So Canva, very, very important. Then Grammarly for your helps you to check your grammar. I mean, structure, does it sound okay? It doesn't sound okay. What's your style? Is it readable? Is it not readable? So these are some of the things Grammarly does for you. And there's a free plan. Then I think there's also the pro version. So it's up to you to decide at what level do you want to take this up to. Then you have the core schedule headline analyzer. So I think marketers use this a lot really because it helps you write stunning headlines. So it looks at your headlines. Is it clear? Is it concise? What's the overall quality looking like? So for those who are looking for sensational headlines that grab attention, this is a very good tool to use. Then there's a Liber Office Writer, there's a Page 4, there's a Wire Writer, there's a Write Monkey, and there's Write It Now. So these are other tools you can use for all of this. The another one I think I forgot, but thank God I remembered, is Quillbot. So I mean, Quillbot is very good for paraphrasing, right? It helps you, you have a paragraph, you put it there, you say, please paraphrase this, you click on it, it changes the whole structure. I mean, without losing the meaning of what you're trying to pass along. So Quillbot is a very good tool. I use it too for some time. So it helps your ministry. So if you're thinking of health content, I think these are some of the basic apps that you should be really conversant with. I mean, the list is not exhaustive, but this is from my own experience, from what I do every day here, either writing a YouTube script or writing an article or collaborating with persons in real time or trying to see what headlines work or what's my grammar like and all of that. So these tools really help me and make my life very easy, right? So, I mean, I don't know what your experience has been. I mean, if you've used any of these tools, you can tell us what your experience has been like in the comment section. If there are any other tools you use that I didn't mention, please pop it in the comment section. I mean, I'm also open to learning. I don't know it also, right? So pop in the comment section. Let me see. So I can also check these tools out. They might even be better than what I use at the moment. You never can tell. And other persons might also learn. So what works for you, what does not work for you. I think one of these days we're gonna have a session about health content writers. I'm gonna be having a couple of content writers on the show. Talk about our journey, what works, what does not work, how do we move forward, and all of that. It's going to be an interesting conversation, really. So I think you might want to subscribe and be ready or be notified when that video pops. It's going to be a live session actually, so you might just want to subscribe to that. So yeah, that's that for today's episode, and until I come your way next episode, I still remain your host, Dr. Ron. So everything healthcare, come to my channel. I've got it covered for you. Bye for now.